Hi, we are group 4. We have choose topic 8, which is CAE in dairy good herds. Can anyone explain about the introduction of CAE and the causes?
Hi and Assalamualaikum. My name is Nufarsha Fitra Metikaman. My metric number is F238090C. In this recording, I will be explaining caprine and arthritic encephalitis, commonly known as CAE, a disease that poses a significant challenge to the dairy goat industry. Caprine arthritis encephalitis, commonly abbreviated as CAE, is a chronic and progressive viral disease that affects goats, with a particular impact on dairy breeds such as Saanen, Alpine, and Toggenburg. This disease is caused by a lentivirus, a type of virus known for its low replication and long-term persistence in the host. Unlike acute infection, lentivirus often remain dormant for extended period before clinical signs appear, making early detection challenging. CAE manifests in several forms, including painful joint inflammation, arthritis, neurological disorder like brain inflammation, encephalitis, hardening of the other tissue, indurative mastitis, and in some cases, respiratory complications such as pneumonia. One of the most concerning aspects of CAE is that affected goats may appear healthy and show no symptoms, yet they continue to harbor and spread the virus within the herd. This silent transmission contributes to the widespread nature of the disease and poses a serious threat to herd productivity and welfare in the dairy goat industry. Alright, the next is the primary agent responsible for CAE is the caprine arthritic encephalitis virus CAEV. Transmission of this virus occurs predominantly through the ingestion of colostrum and meat from infected thus making vertical transmission from mother to kid a major concern. However, horizontal transmission is also possible and can happen through direct contact between animals, especially in crowded or poorly managed facilities. Can anyone explain about transmission and clinical signs?
Hi, my name is Siti Farhan Binti Mazlan and my matching number is F2380893. Let me explain about transmission and clinical signs. For transmission, CAE is a slow-acting viral disease, and once a goat is infected, it stays infected for life. The virus spread mainly in two ways, from mother to kids and goat to goat within the herd. The most common route is through milk and colostrum. A doe that is infected even without symptoms can pass the virus to the newborn kids simply by nursing. This yearly infection is very dangerous because young kids absorb the virus easily. The virus can also spread horizontally or from one goat to another. This happens through close physical contact, small wounds, or body fluids such as saliva and nasal discharge. Contaminated equipment is another big risk. For example, using the same needles, machine, or hoof trimming tools on multiple goods without proper cleaning. Transmission may also occur through blood exposure, such as during castration, dehorning, or injuries. Breeding contact can contribute as well, especially if equipment used for artificial insemination is not self-sterilized. For clinical signs, CAE can appear in several different forms, and symptoms often develop slowly over time. The most common form in adult goats is arthritis. Affected goats show swollen joints, especially in the knees, stiff walking, lameness, and difficulty standing up. Over time, the pain reduces their mobility and leads to weight loss. In young kids, CAE often appears as encephalitis or inflammation of the brain. These kids show weakness, trembling, loss of coordination, and eventually paralyzed. they may have trouble tending or suckling, and unfortunately, this form is usual fatal. Another important form is mastitis, commonly called heart udder. The udder become firm, milk production drop, but there is no heat or redness like typical mastitis. This affect the amount of milk the kids receive. Some goats also develop chronic respiratory problems such as coughing, difficulty breathing, and gradual weight loss even though they continue to eat normally. Finally, many infected goats remain asymptomatic for years. They look healthy, but they silently spread the virus within the herds. Thank you.
Okay, I'm Izn Arif bin Mazuddin, and my match number is F23B0429. So, I want to talk about CAE testing protocols. For first, serology, we use like ELISA and or AGIT for main method, and ELISA is the most common screening test, and AGIT may be used as a confirmatory test. And then it can detect antibodies, not the virus itself. So second, for the recommended testing schedule for adult dose and bugs, test the whole herd annually, and then high risk of previously infected herd test every 6 months. And for kids, kids may test negative yearly due to delayed antibody formation. So recommend for kids, first test at 6 months and retest at 12 months, then annually. And number three, bug time MIC ELISA, useful for herd level screening, and then can detect infection without sampling every animal, and should be done regularly, monthly to quarterly, as part of monitoring. So number four, PCR optional or confirmatory, detect viral nucleic acid and use for confirmation or research, not routine farm screening. And then number five, interpretation of result. Positive means infected for life, and then negative does not 100% rule or out infection. If exposure was recent, retest in 3 to 6 months, and then kids must be tested more than once due to maternal antibodies and later seroconversion. And second, I want to talk about CAE prevention and control. So first, prevent infection in newborn kid. So for prevention infection in newborn kid, we should remove kids immediately at birth and feed heat treated or pasteurized colostrum, like feed pasteurized milk or milk from CAE negative dose. And then do not pull colostrum or milk, and then rest kid in a separate clean area away from adults. And then number two, segregation, test and remove. Option A, test and cull, remove all positive animals from the herd. And option B, permanent segregation, keep positive and negative groups strictly separate and no shared pens, feeders, waters, and equipment. Number three, close herd and biosecurity. For close herd and biosecurity, do not buy animals unless they are certified CAE negative. Quarantine new arrivals 30 to 60 days and test before mixing. Avoid sharing equipment between herds. Keep kidding pens clean and separated from adult herd groups. And number four, routine monitoring, animal testing for animal. Bug tank meet ELISA every 1 to 3 months for dairy herds, and keep detailed record like ID, test dates, results, and offspring origin. And number five, management practice. Reduce close contact between groups of different CAA status, and use separate housing like negative adults, replacement young stock, positive adults group, and sanitize feeding tools, making equipment and pens regularly, and avoid nest. And then number six, long-term eradication strategy. Start with whole herd testing, apply strict kit management and pasteurization, segregate or remove infected adults, maintain a close CAA negative replacement stock, continue annual testing until the herd becomes consistently negative. Okay, that's all from me.
Thank you so much, Isnimu. You are presenting about CAE test protocol and also prevention and control. So, Izatul, can you tell us about herd segregation and also make conclusion about this presentation?
Thank you, Hanum.
My name is Melissa Tulida. My metric number is F580885. Today I present about the situation. Firstly is uh, kid group. The kid group consists of boys aged 0 until 3 months. At this stage, the focus is on meal feeding, immunization, and early growth. They require a stable temperature, clean and dry access, and a supplier of meal or meal principle. Second is grower group. The grower group includes infants aged 3 until 8 months. The main focus is they grow and introducing them to forage and concentrate. They need balanced nutrition and enough space to move and develop properly. Thirdly is pregnant doom growth. Pregnant doom growth focus on the health and nutrition of those before feeding. Theirs cause needs a high energy and high protein diet, as well as a comfortable and safe space for feeding. And the last is less window group. They focus on achieving optimal meal production. They require high energy, high protein feed, and consistent milking schedule to support meal need. And the conclusion is CLE is a long-lasting disease in the regards that reduce their meal and health. It spreads mostly from mother to kid through milk and cannot be cured. Even so, farmers can control it by testing the cause, separating infected animals using clean equipment, and feeding kids specific meal with good management. The spread of CAE can be reduced and the herd can stay healthy and more productive. That's all from my group. Thank you.